So the presentation was in two parts. Firstly, kind of summarising the evidence of what we already know about the effectiveness and the efficacy of stop smoking provision within lung cancer screening. And I think the general summary of the evidence is we are getting there with an evidence base, but there's quite a large variation in what research is already out there in terms of the setting and the interventions that are being tested. So whilst we're getting there, we still need high quality evidence, I think, around what interventions we should be targeting. The second part of the presentation was looking more specifically at the research I'm involved with, which is the Yorkshire Enhanced Stop Smoking study, or YES. And we're nested within the Yorkshire lung screening trial. And basically our service model is that every smoker who attends for lung screening as part of YLST is offered an opt-out immediate consultation with a smoking cessation practitioner on the van. We're a co-located service. And as part of that, they're offered a full series of behavioural support and a choice of pharmacotherapy and or e-cigarettes. And we provide support for the first 4 weeks in line with NICE best practice guidance. So everyone gets the same service for 4 weeks. And then after the 4 weeks, we have a trial looking at the provision of some personalised materials. So using scan images of the heart and the lung and using that as part of the motivational and information package, which we'll be testing to see whether the use of these images is more effective in providing a stop smoking intervention to this group. So to give the highlights of our own research project, I think is really important. And we saw over 1,900 smokers come to see our smoking cessation practitioner on the van, and that was 88% of everybody that was eligible. So I think that shows a real strong evidence base that actually having this co-located service is popular. And the patients that we've seen have actually been really welcoming and supportive of the service, as opposed to it being, something that's putting people off and maybe meaning that they're not wanting to come and engage with it. And of the people that do come to see the SCP on the van, again, the vast majority agree to ongoing support. So 84% of the people that see us sign up to this ongoing session of quit support. And our 4-week quit rates are actually really positive, between 12 and 17% of all smokers, depending on what we use as our denominator, because there's different subgroups. So I think the evidence here is really, really promising that having this co-located service is something that we should be looking to do. So providing meaningful support is really important. And also our 12-week quit rates, whereas we've not finished collecting and analysing the data on that one at the moment, our 12-week quit rates are between 18 and 38%. So it's really positive in terms of what we're doing. Again, let's say the feedback that we've had around the booklet has been really positive. A lot of people have seen it as being a motivator that they can apply their thought process to their own hearts and their own lungs rather than just being told. They can visually see it. I think the other thing that I'd just like to highlight is some of the main lessons that we've learned through the research that we've conducted. And I think our SCPs are incredibly skilled in working with this particular population who are high risk, and they have, they'll tell you they've been there and done it. They've been smoking for 50 plus years, a lot of them. And so they've been and tried everything. So having a team who are specialised and know how to engage with this group is really important. The other thing is that we're an integrated part of the lung health check, the lung screening programme. We're not an add-on. We're not seen by an add-on as either team. And I think we're not seen by an add-on by our participants either, which is really important to making it clear how important what we're doing is and that it's the same part of the same offering. Our SCPs are there, they're convenient for the people, they're very approachable, they're non-judgmental, all the sorts of things that we would try to get across in a smoking cessation intervention anyway, particularly with this group is really important. Let's say we've been really positively received. The early findings suggest that we are doing good and that we should be continued in part of lung health checks, and also that we shouldn't be just a one-off. So we were originally, as part of our research, to look at the first round of screening. We've had additional fundings that were present for the second round of screening now. So we're seeing some of the same people twice. We're seeing some people who refused to see us the first time around, who perhaps weren't ready to engage at the point we saw them first time, but they're now ready on the second round. And I think the final thing is just considering capacity. So I think if we are going to roll out a lung cancer screening programme in the UK, And we do accept that smoking cessation is important. And I don't think there's many people now that would argue that it's not important. The question is not if we do it, but how we do it. And thinking about having the correct capacity and being able to offer, a true service, particularly to the disadvantaged groups, that we are offering the best practice service for them is really important. And it needs to be considered how the smoking cessation element will be meaningfully supported if we move to a national rollout.